This segment is sponsored by American Academy of Sleep Medicine. The quality of your sleep is one of the most important aspects to your overall health, and your sleep habits start in childhood. So here to help us create healthy sleep habits for our kids is Dr. Jennifer Martin from the American Academy of Sleep Medicine. Thank you for joining us today.
Happy to be here. Thank you so much.
Okay, I need to know the answer to this question first, Dr. Martin. How much sleep should children be getting? What's like the golden hour?
Well, it really depends on the child's age. Infants under the age of 12 months actually need somewhere between 12 and 16 hours of sleep per 24 hours.
Wow.
Anyone who's a parent know babies don't get all their sleep at night. When we think about school-age children, for example, 6 to 12-year-olds need something in the range of 9 to 12 hours. It varies according to different kids' needs. But I think we know that a lot of American kids aren't getting as much sleep as they need to be healthy and at their best during the school day.
Is there any tools that you use to measure that sleep for children?
A lot of the research that's been done is using movement or actigraphy on kids while they're sleeping at home. And that's one of the ways that we can look at in large groups of kids how much sleep they're getting on school nights and weekends.
Okay, so I know it kind of based on your age. Other factors also play into how much sleep a child needs?
Age is the main predictor. And I think, again, one of the important things is that a lot of American kids don't get the sleep that they need, either because they're going to bed too late, or in the case of teenagers, because they have to get up so early in the morning to start their school day, earlier than their body naturally wants to wake up.
Right, right. Okay, so let's say we're not getting enough sleep for your children. How does that impact your health? Why is this so important for your health?
Well, there's two main reasons. One is it affects a child's physical health, so they're more likely to get sick. You're actually more likely to catch a cold if you don't get enough sleep, things like that. So it affects their immune system. It also puts them at risk for diseases later in life, like type 2 diabetes, and it affects their well-being and mental health. So we know that kids who don't get enough sleep actually have higher risk for things like depression.
Wow. Does it impact their development too as they're growing, not getting enough sleep?
You know, I don't know that the data are quite as well established for things like growth rate. Mostly we think about health conditions, and again, that the issue of mental health is really prominent, especially in teens.
Okay. I know that I assume that research is very important. Is it in understanding the role that sleep plays for children?
Yeah, I think there are a couple of really important areas of research where the science would really help us do better for kids. One is understanding how best to diagnose and treat sleep disorders in children. A lot of developmental psychologists and pediatricians would tell you kids are not just small adults. And we have relatively little research on how to diagnose and treat sleep disorders. The other is figuring out what kinds of policies we might put in place to encourage and support good sleep in kids so that they can feel and function their best. Those are just two examples of, I think, the unanswered questions we have in the science around a healthy sleep for kids.
Excellent. Thank you, Dr. Martin, for all the advice. It just makes them a more pleasant child, too.
Definitely does. I think that gets back to that child well-being issue. A well-slept kid is a happy kid.
Exactly, exactly. Thank you so much for all the information today. Again, for all of this information and even more, you can head to sleepeducation.org.